We are live for yet another live lecture that has been arranged by SoMe Docs or Doctors on Social Media. For those that are watching this live as it's being live streamed, my name is Donna Coriel. I'm the creator of SoMe Docs. You can find SoMe Docs and the many, many resources that we have built for you for professional growth on doctorsonsocialmedia.com. I am soon going to introduce Dr. Brook Choulet, who is going to speak to us about how to start a concierge practice in less than a year. I'm very excited to hear this as a formerly practicing internist who was considering, different possibilities and what I could do with my practice to make it more successful and to connect with patients better and in a much easier way. You can find this lecture and all the other lectures on doctorsonsocialmedia.com, and you can also join our network as well, which is just a way to get more visibility for your work and get more lectures accessible to you. We have another live on Thursday after this that is called How Can a Doctor Maximally Use Social Media for Better Lead Generation? And it's coming in from a marketer. That marketer is going to join our network for the next month and answer our personal questions, the questions of the network members. So please consider joining us for that and others. Sunday, we have a continuation of our How to Podcast Focus series called How to Have an Amazing Conversation. And that's with Drs. Taylor Brana, Dr. Colin Zhu, and Dr. Bradley Block. You could watch these directly on our website. There's actually no need to tune into Facebook, but if you do tune in, you can actually ask questions there. And you can also do that on YouTube as well. And then last but not least, relevant to what Dr. Choulet is lecturing on, there's a physician practice automation summit starting today from Dr. Chang Ruan, who was in our networking session on Friday. You could catch the footage for that in our Facebook group. All right, that's the end. So, Brooke, I'm going to actually let you introduce yourself and step off the virtual stage. And I will be back when Brooke finishes to ask her any of the questions that you may have from the audience. Okay, Brooke, you ready?
Yes, I'm ready.
Wonderful. Here, I'll allow you to introduce yourself and I will get off the stage. Here we go.
Okay, wonderful. Well, I am Brooke Choulet. I'm actually a PGY5 in child and adolescent psychiatry. And I started to really wonder during my residency training how I wanted my future to look in terms of jobs and job satisfaction. I know there's a lot of focus on burnout right now. So it got me thinking that I wanted to create a concierge practice where, physicians can determine what kind of care they wanted to provide to patients. So what I'll talk about today is how to start and scale a concierge practice in less than a year. I just did this, so I think I'm in a good place to speak on this, what I've learned through the process, and what I would share with other people who are interested in doing this. So I started to kind of develop this idea in my PGY3 year. So I'll kind of walk through my timeline and what that looked like to give you a real sense of how quickly you can do this too, if this is something you're considering. So objectives for today is to really understand the process of how to build a business, learn how to set up a practice that's not only feasible, but also scalable, identifying kind of some of the benefits as well as the obstacles that I encountered along the way, identifying helpful marketing strategies because everyone is really curious about how to market new practices in a cost-efficient way, and then how to maintain the growth. So once you've built up, what now? So what is concierge medicine for those who don't know or aren't as familiar? It's really a model of patient care where patients are provided, direct accessibility to their physicians. And there's a lot of different kind of fee structures and ways to go about this. And I'll kind of get into that a little bit. But to me, concierge medicine is a direct kind of patient-physician contact and not going through a large phone tree system with, MAs and front desk staff and things like that. So really providing that level of convenience to patients. So here's a little bit about my story. So like I said, I started coming up with this idea in my PGY3 year. I started in my fourth year, so my first year of child fellowship in kind of the essential building blocks of how to build a business. And I'll get into that a little bit more. In September, I really started implementing that. Then July of that year, continued on. In January of this year, I published my website and getting ready to open for July. I rented a single office space to keep my overhead low and kind of figure out how I wanted to scale the business in February. Then in March, I really started pushing advertising, what I would be offering. In April, I hired an attorney to review contracts. I started to get my accounting in order. And then in May of this year, I actually started booking patient appointments for July. And at that point, I was solo, and I'll get into more kind of how it expanded so rapidly. But moving from May to June, I then signed a commercial lease for 8 office spaces with no other people in my business, but just a vision and a plan to expand. July 1st, I started seeing patients, meanwhile, starting my 5th year of fellowship. So I'm in my last year now. And then between July and August, I hired 5 independent contractors within an 8-week period of time. September of this year, so within a few months, we had 150 active patients in our clinic, and I took my board. So that I kind of regret overwhelming myself at that point in time. And then I had a good structure in place, so I wanted to replicate that. And I filed for a professional corp in California to start a second practice in California. So that's kind of my timeline and where I've been this last year and why I think I'm able to speak on this topic in particular. So, big picture, when you're setting up a concierge practice, the first thing is to develop a business plan. So, what do you want to do? Who do you want to market to? What is your vision for your space? The next step is really setting up the business. So, all of the not fun, dry activities of forming a corporation and getting your accounting in order. That third phase really is implementing the action plan. So now you have this idea, you have the legal structure in place, but what now? Fourth would be marketing and then also maintenance. I think a lot of people go really hard right out of the gate and they market, really successfully, but how do you maintain that momentum moving forward? And then the fifth thing, and really what's extremely key to growing and scaling, is having systems and automation in place. And we'll get more into that, what that means in particular. So in step one, you really want to develop that business plan and identify goals. So are you thinking of doing a solo versus group practice? Are you going to be in the office, telemedicine, mix of both, cash or insurance based? And really with concierge practices, it's cash and out of network, so no insurances. Who are your patients you're looking for? Who's your ideal client? What population will you be serving? And then really developing 3 words to describe your business. What type of workplace environment do you want to have? And what's really important to you growing and moving forward? So kind of taking all those things into consideration and really putting some thought and effort into the business plan first before you even start to implement anything. The second step is really the nuts and bolts of just the legal aspect behind creating a business. So, are you setting up a corporation, an LLC, a PLLC? What are you going to name your practice? What the website domain is going to be? So, these are kind of all of the basic steps of just building a practice in order to be able to move forward. So, you'll need a tax ID. Maybe, it's a good time to get an accountant or an attorney. And I do think that that's one thing that, starting a business is really it's really costly and expensive. So I think a lot of people try and get forms from other docs online or trying to take shortcuts, but it's really important to get a really good foundation in place. So you'll definitely want an attorney and an accountant who can help walk you through the legal aspects of setting up a business successfully and in a legal manner. Next, you'll really want to think about your fee structure of the services and how payments will be processed. Again, it's all about getting systems in place so when you open and scale, it's easy and flawless. So, are you going to be retainer or non-retainer based? Then you'll want to actually set up communication methods so people can contact you. So you'll want a phone and a fax system, leasing an office space, or getting a virtual mailbox if you're doing a telemedicine practice only. These are really just a few, but it gives you an idea of all of the small details that go into building a practice from the ground up. The next phase is implementing the action plan. So now you have your vision, you have the legal structure in place, but now what? So, a few things listed up here would be creating a website, which again, it really helps when you have that vision already established of what you want to do and how you want to do it. Will make writing content for your website and marketing materials a lot easier. You'll want to select an EHR, really take your time and make a list of the things that are important to you and important to automating and making your practice more efficient, and select an EHR based on those things. Then you'll want to have your lawyer review consent forms, determine your fee structure, get business and liability insurance and malpractice insurance. Do the small things like get your lab order forms in order and get ready to really think about what you'll need to start accepting that first patient in your door on day one. The fourth step is marketing and maintaining. And I think this is where things get complicated for some people, because you can do all the right things. You can have the attorneys, the accountants, have everything in order. You're ready to go, have a space, ready to open your doors. But now what? And I think, it's really scary because a lot of people associate marketing with being really expensive. And what I hope to share today is that there's some really cost-effective ways to market really effectively. One thing that is pretty well known is Google pay-per-click ads. So you can set a daily budget on Google and you can set certain keywords and have your clinic populate every time someone Googles that keyword. That does cost money though. Then a few other things, keeping the Google business page updated. There's a lot of articles on Google algorithms and things you can read, but essentially keeping your Google business page updated is free. And it allows you to show Google that you're still staying relevant and making real-time changes. So with that, you can make posts and updates weekly, saying that you're available for appointments, announcing any new information, keeping all your services and office hours, contact information up to date. And what I will say too is the more consistent the information is across different platforms, the better your website and Google business page will perform. So rather than maybe on health grades, you say, 7702 East Doubletree Ranch Road, number with the number sign 300. Well, instead on Google, it may say Suite 300. You really want to make sure across all platforms that your information is consistent. So you can show Google that you're a consistent, reliant business, and it'll help you boost your position on Google more. So that's a free marketing tool that you can make those posts and updates weekly. Another thing is contacting your local media outlets and asking them to run a story on your practice. All of the articles I posted on this slide are all on these different various media outlets in my local community, and I didn't pay any money for any of these. I think it really is a kind of untapped tool that you can contact all of the media outlets in your area and just tell them about what you're doing and ask for them to feature you. And you may get a lot of no's, but then you'll get yeses. And this promotes not only your services to the local community, but these backlinks to your website really help boost your position on Google, and it really helps with your practice presence in your area. Next thing was just basic postcards. So I made postcards of what services I was offering, where my practice was located, and I sent it to all the physicians and other therapists in the area that I thought our services would be relevant to. And that was also a great referral source for us as well. And then podcast appearance. So you can reach out to people that you think, your story may meld with well and ask to be featured in their podcast. And it all helps with promoting your name and promoting the services you're offering, as well as providing good information to the public too. So again, these 5 things I listed up here are either have no expense or are not that expensive. So I would definitely take the time to reach out to people in your area and ask to be featured. So the keys to scalability, systems, automation, and outsourcing. So, the systems in place would be your daily workflow. So how are patients calling in? How are they getting scheduled? How are they receiving intake forms? Those are the systems that are in place in terms of a daily practice workflow. Then automation comes in, because if your systems are that you're sending, intake forms by paper mail, or that they have to come into the office and fill out the forms, it's not very efficient and it's hard to scale that. Whereas when you automate your systems and you have intake forms sent automatically and appointment reminders sent automatically, it helps take out some of that work to allow you and your office staff to focus on other things that will help the clinic grow. Then outsourcing is coming to asking for help. And I think, me especially, and I talk about this later too, when I started, I thought I could wear all the hats and do administrative, scheduling, all the things, marketing, social media. And it's not only is it exhausting, but it stifles your growth potential, because then you're focusing on doing all of these things that you could have other people help you with. And then you don't have the bandwidth to help scale and grow your business more. So I definitely think outsourcing from the beginning, where you have an attorney that can help with legal questions, rather than you spending hours online trying to filter through legal jargon on your county website, and having an accountant who's running payroll and doing your books, having an office admin assistant who is doing the scheduling and intakes and ensuring invoices are paid. So I think these three things are really the key to scalability and practice growth. So how I built systems to automate my business, one, like I kind of touched on, was a smart EHR system. So automating appointment reminders so that no office staff is having to text or make those calls manually. Sending a welcome email with intake paperwork, and that providing information on where we're located, how to get to our suite, and it all comes automated, so that eliminates those phone calls, and the intake paperwork process. Then automated payments for services rendered. This is the biggest one that's really helped automate my practice, especially, is that every time a patient comes in for a scheduled appointment, their card is auto charged 1 hour after they leave. And that's through the EHR I chose for my practice specifically. So finding those small things that really take a lot of time during the day and finding ways to automate them or outsource them will help you have more time to do other things and not feel as burnt out. Then, the payroll and bookkeeping, like I touched on, have an accountant that can help do those things. That's their job. We are not accountants, so just help and rely on someone else to do that. And then an attorney, and taking the time to hire a practice manager and admin assistant. So some of the pros and cons to scaling quickly. So like I said, July 1st of this year, I started Choulet Wellness solo. It was just me. And then today, as of the beginning of this month, we have 9 people on our team total. And some of the pros of that is, obviously, with more people, you have more ability to see more patients. So there is increased revenue. It does build a larger presence in the community. So rather than having yourself be solo and maybe not having a large presence, now if you have several people providing services, it helps expand your network more quickly. It also makes hiring other people easier when you are interviewing to bring on other clinicians or physicians into your practice. If you have several people in your practice and it is a larger group practice, it's easier to hire people on than maybe they may feel hesitant if they're only the second or third person to join your group and wonder what the future will look like. Some of the cons, though, is that it is harder to manage from the start. So when you're just starting a business, it's already hard enough. And then throw in adding 5 independent contractors within a month. It's a lot of work. You have to onboard everyone, make sure your systems are working efficiently, make sure everyone understands your workflow. So there are some negatives too, because you will feel that added pressure to get your clinicians and physicians more patients, because now instead of needing to just fill yourself up, you have to fill up 9 people. So those are some of the pros and cons, but looking back, I wouldn't have done it any differently. I think it was a lot of work and it was a lot of time, but I'm happy with the way we grew quickly, and I would do it again if I had to. So obstacles and what I would have done differently. One mistake that I did make was hiring a physician initially out of a sense of urgency, even if it wasn't a good fit. And that's why I emphasized at the beginning that you'll really want to think about three keywords of how you want the culture of your business to be known as, not only to the community, but to the people you hire on to join you. And I do think that that was a mistake I made, was picking someone that didn't quite fit, and I had to eventually let them go because they just weren't providing a concierge level of patient care. And then just two other obstacles, like I said in the previous slide, is just onboarding, training people quickly, because I delayed hiring admin support. And looking back, I wish I would have hired her earlier, because it really helped alleviate a lot of stress and open up my time to scale the business while she took care of the day to day. And then the other obstacle is really just onboarding several people at once. It's just a lot of work, but I wouldn't have done it differently. Does anyone have any questions?
Hi, I'm back. Are you finished with the lecture?
I am.
Wonderful. All right, let me remove it. We got a lot of positive feedback, and I'm going to read you a few, but I think there's a lot of people working right now, so they'll watch this after the fact.
Mm.
Fabulous points. I shared them on one of the platforms. This was being live streamed into several platforms. So I shared them in one, and there wasn't enough time for me to get out the things that you were saying. So great advice. Thank you. First of all, someone said, and live stream doesn't allow for names unless they log in. So great talk, very inspiring. Thank you so much. There are two questions coming in, but before I flash that, let me flash what Dr. Marlene Smith wrote. She's part of our network, and she also has a magazine for physicians, and I really love her work. I love this, Dr. Choulet. As a pediatrician who loves spending time with patients, I left employed practice to be able to build a virtual telemedicine concierge type practice. I also have a vision for healthcare reform using free to care concepts so that all patients can afford this type of patient physician concierge care.
That's
Great.
incredible. Thank you for sharing, Marlene.
Absolutely. And I know Marlene, I'm sure she'll get in touch with you just to get some more visibility for your work. All right. Another person. So Marlene actually had a question. I don't know if you feel comfortable doing this, but this
Sure.
is great for us to learn, is how much do you charge?
Yeah, so I believe truly in a non-retainer based model, because with psychiatry especially, it's such a personal choice that I would feel bad locking someone in to see me for a year if it wasn't the right fit. So the way I practice concierge medicine is really different than most people. So I charge an hourly rate, and then it allows patients to either utilize me or as much or as little as needed, but they know that they have that direct access. So we actually only charge a little bit more per hour than the private practice docs in town. So for an initial child psych evaluation, it's $450 per hour. And for adult, it's $430 per hour.
And I do know that as an internist, I can say that I feel safe to say two things. First of all, that the rates obviously differ based on where you're practicing. Clearly, you serve different populations, um, but also that um, internists can't usually charge that high of a rate. So I think it also does depend on the field that you're practicing in.
Right. And I think that that's why internal medicine especially does really well with the retainer based, because like you'll probably want a few sick visits over the year and one, annual physical. And so it seems to be easier with medicine to be able to have some kind of a notion of how many visits your patients will need a year. Whereas I see some patients every week and I see some patients every month. So it would be really difficult to establish one kind of set cost for the year.
It's also probably based on the fact that with internists, I think there's so much more variability as to what we do for patients, what we
Right.
provide. Whereas, and again, psychiatry, very complicated field, but I think with psychiatrists, like you come in as a patient and you speak about mental health. I think that's
Mhm.
for the most part what you're dealing with. All right, there are actually a few other questions. So I know Dr. Lewis Chug is watching and asking questions. So hi, Lewis. So have you found administrator support?
I did. So I initially hired someone just out of desperation that I found on Facebook, and it went horribly. It lasted about 7 days. She wasn't answering the phone, which is kind of a critical role in this. So I did end up finding someone else through actually a local community Facebook group, and we she's been wonderful. She's been super helpful. I really took the time to train her. She's just great and really helps just with the day to day to allow me to have meetings and set up, other things that would allow for us to scale and really grow the business rather than I was like running out of didactics initially trying to like answer patient calls to schedule appointments. And I just did not have the time or bandwidth to do that.
Yeah, I think ancillary staff is super key. They also actually, and I don't think anyone would disagree with this, but they represent us. So
Right.
the person who's answering your phone is representative of you, even if they're a separate human. I think that that's actually one of the struggles that many of us have when we're working for a health system, right? Is that because we're actually not in charge, we are actually removed from those decision making, from the decision making on who actually represents us at the front desk. And
Mhm.
then there's that mismatch of, for example, when they're not doing their job or when patients are not happy with
Mhm.
that representation, you have less recourse as to what to do about it because you're not the person who's deciding. Do you agree with that, Brooke?
I do, and I think that was the hardest part for me is giving up that control because, when you're building a business, it's like your child, right? And you're putting so much time, energy, and love into it. And then when you think of like someone else answering the phone and someone else representing you and being the face of that business, that's why I just couldn't go through with the virtual companies I had interviewed because it just didn't feel personal and they didn't like convey the vision I had for the
Ugh.
space.
I'm getting goosebumps because I so relate. Even now that I'm building a digital platform, right? It's been me that's at the control because it's so hard for me to let go of something that's kind of futuristic and how I'm building it out and
Right,
bringing in docs that I'm dying to bring in, and yet not everybody sort of gets the vision of what I'm building or how I'm building it, and so that
right.
process is taking so much longer but is hopefully building a strong foundation to my venture in the same way that Dr. Choulet's venture is taking a long time because you're so maybe picky about who you're bringing in to represent you.
Mhm. Right, and I think that's what's important for people to realize is that the goal is to scale quickly, otherwise it's not going to be a profitable business, and then you will be unhappy and not satisfied.
That's super interesting, and I think we've tapped into something that's very, very true to so many doctors who are going to be tuning in here who are working for bigger institutions. And while there's nothing wrong with that, and we actually need that to some degree, this is part of the key to our regaining happiness in our profession is more of that control. Dr.
Right.
Choulet is offering just one of the ways that we can bring back control as the physician in our practice. There exist many different ways, but it's something to start mulling over, especially for those of you that are more in the initial stages of like, wait a second, why am I unhappy? And those of us that are a lot more experienced and older that have experience in working for system and can actually take a step back and not only identify what's wrong with working for systems today, but bring forward solutions to how to change working for them to make you happier. Does
Mhm.
that make sense?
It does.
Awesome. All right, let's move on to the next question. Just a quick comment from Marlene Smith. I love the hourly rate. Okay, wonderful. And one last comment from her. In my utopian healthcare world, a traditional low income Medicaid patient would have a very well funded health freedom account in addition to a no frills state national universal health plan. I love that. I think that we should come up with solutions for everybody so that
Mhm.
everybody gets treatment and everybody is happy. There's sort of more of that equalization. All right. Looking back, what tasks you gave to your administrator that allowed you to scale your practice?
So I think that's super key is asking yourself what is taking the longest time out of my day, and then how can I help automate that? So one thing for me was I was constantly checking to see if intake forms were completed
Mm.
prior to the patient showing up for their appointment, because our payment processing automation relies on completion of that paperwork. Because in our EMR, when someone fills out intake form and credit card authorization, it sucks that information and auto creates a square profile, allowing that auto payment to go through. So if someone doesn't complete the intake forms ahead of time, then it adds, extra work where you have to create a manual invoice after the fact. So that was one thing, was creating and making sure intake forms were sent and completed on time. Another thing was scheduling both by inquiries over email and by phone. And then super important that I've realized is having someone live answering the phone. We've had people where when she's on her 12 to 1 lunch, they'll call like 3 times in a row, hoping to get someone live. And it really has made an impact. We'll get people that say, I've called around to 3 places and just got voicemails. You're the first one that answered. So I think just literally having someone live representing your practice is huge.
I've actually heard of institutions that outsource that phone answering service,
Mhm.
actually even to other states,
Yeah.
which I think is is doing a disservice to patients because you're now not even close to the doctor and can't really ask them questions if something
Mhm.
comes up. I just think that that's literally just, I don't know, I feel like that's throwing healthcare a
Yeah.
healthcare relationship down the drain. It just shows just how much of the business has crept up. You can absolutely incorporate the business aspect into the healthcare relationship and still maintain the integrity
Mhm.
of a healthcare relationship. That's how I feel. All
Exactly.
right. I think we'll take the last question because I really do want this to be short, 30-minute segments. Dr. Smith has a few questions up. Let me bring one up. How many EMRs did you look at and which one did you end up using?
So I looked at 15 EMR systems and made a list ahead of time of the things I wanted and the things I didn't want. And I ended up going with a non-traditional EMR in the sense that it doesn't have e-prescribe integrated, but it literally is the most automated thing I've ever seen, and that's intake queue. So intake queue is, automates the scheduling, the intake forms, auto creates patient profiles from the intake forms. Creation of super bills super easy, which is key in an out of network practice. Does the automatic payment processing. I could go on and on. It's incredible. So it had everything except e-prescribe. And since there's so many e-prescribe apps out there, I was like totally okay with that because it just automated everything.
Fabulous. The key really is, it's so funny because I posted earlier on LinkedIn and my personal brand just how
Mhm.
key automation is, including just setting up these live series, which is coming
Mhm.
to you. I'm going to just flash up one last question because it does have to do somewhat with what SoMeDocs does, and then let Dr. Choulet answer as well, is how do you get patients to come in? That's super important for us as physicians today,
Mhm.
not only when we build our own private practices, because that then it's obvious why we would need marketing, right? That's sort of the face value obvious answer to getting patients through the door. But you should always think about patients coming in to you as a physician,
Mhm.
using the online world, in that if you actually build a space online and start getting an audience and followers, right, you can pick them up and they can go with you wherever you go, because
Mhm.
the world is now connecting in a much more than a personal way, right? An
Right.
actual physical touch way. We're also connecting online, and we're following people's intellectual property. We're actually following their essence and what they say and how they communicate online. So it is more important than just marketing locally to your community. It's important to market yourself and
Mhm.
your personal brand online, and get followers there. And then you can build satellites everywhere. Brooke, do you want to weigh in on that as well?
Yeah, I think it goes back to that kind of marketing and maintaining slide of the really just local for my practice in particular, since it is a concierge practice, I can only see patients in the state of Arizona. So for me, it was a lot of local marketing through the Google pay-per-click ads, keeping that Google business page updated, contacting a bunch of media outlets, sending out postcards to every concierge physician in town and therapist. So for from a psychiatry standpoint, it was actually quite easy because a lot of people moved to telepsychiatry and teletherapy and just closed their offices, which I think personally is a huge disservice to patients because they are longing for that interaction in person with anyone, let alone their psychiatrist. It's so critical. So, we had lots of calls that were like, thank you for just seeing us in the office. So I think getting patients to come in to the office was not an issue.
Wonderful. All right. And with that, I do realize there's a few other questions. Brooke will, is it okay for you to go into the Facebook group and answer those questions?
Sure. Yeah. That is no
Fabulous.
problem.
All right. So this has been really, really great. If you are tuning in now and have missed it, you can catch it anytime on our website at doctorsonsocialmedia.com. This one is in the series section, and the series is How to Physician. We have so many more lectures coming to you, and maybe Brooke will even join us at another time because she's added so much value to the space. So, Brooke, I really appreciate you hopping on.
Thank you.
You're welcome. Have a good rest of your week, everyone. And tune in. The next lecture is Thursday on marketing. And that's really important for all of us, right? Whether we open up our own practice or we're growing an online brand to supplement. Bye